Hello, I am Dillon Rosenblatt, the Governor's Office reporter for the Arizona Capital Times. We are now going to be doing weekly Q&As with people via Zoom instead of our weekly Q&As we would do for our paper that comes out on Fridays. For the first one, I am with Will Humble, who is the Executive Director of the Arizona Public Health Association, and he was also the previous State Health Director under Governor Jan Brewer. Hello, Will. Thank you for joining me.
Okay, thank you for the opportunity.
Yeah, let's get right into it. A big thing that people have been talking about and debating is whether or not someone should be wearing a mask in public during this COVID-19 pandemic. Maricopa County and the city of Phoenix both are making it mandatory for employees to be wearing a mask when they cannot socially distance. The governor has not been wearing a mask at his press conferences or any photo that's been taken of him in the past couple of months, which has drawn a lot of criticism. I'm curious where you stand on, should people be wearing a mask right now, why you think they should or should not, and what you think the governor and state health director, by not wearing a mask, is setting for the rest of the state.
So here's the way I look at it, that mask wearing is an evidence-based best practice that works and it's inexpensive. So why wouldn't you use a tool like this? Because it's so many of the tools that we have for this during this response are super expensive. Take the stay-at-home order. How expensive was that? All the people that lost their jobs, all the lost income, the decrease in gross domestic product here in Arizona, super expensive intervention. Why don't we compare that to mask wearing? It's not a silver bullet. Mask wearing isn't something that's going to change everything on a dime, but it's an evidence-based practice that works. It's inexpensive. And why wouldn't we take advantage of something like that and put some criteria in place and some level of expectation that everyone would wear a mask in public, indoors? I don't think it makes sense to require people, if they're going to go walk the canal or go on a hike or just be outside, it doesn't make sense. If they're not in close proximity to other people, to wear a mask in public. But if you're going to be indoors at a retail store or something like that, why not ask people to wear a mask? It's inexpensive and it works. Compare that to if we don't do things like mask wearing, we could end up in another stay-at-home order, which has huge consequences in the community, lots of collateral damage. And we could also put ourselves, if we don't implement simple measures like this, we could put ourselves in a position where we're exceeding our hospital capacity and the standard of care is decreased. So why not use the simple things like mask wearing to get us to that point where there's a vaccine later on, hopefully at the end of the year or early next year. It just doesn't make any sense to me that this has become a political item or a political issue. And going to the other part of your question, one of the ways to incentivize people and show leadership is to wear masks in public if you're an elected or appointed official. And sadly, that's not something that we're seeing right now.
So one question that was asked in a recent press briefing with the governor and state health director is, does the governor feel like he has a responsibility that he should be wearing a mask? And it's not a question that he answered. I'm curious where you think, do you think our elected officials have a responsibility that if they're going to tell the state of Arizona, you should be wearing a mask, or maybe you should be wearing a mask when you can't socially distance, that they themselves should be following their same advice?
Of course, the answer is yes. And it's simple. People like to see people. It goes all the way back to kindergarten. It goes back when you're a kid. If your parents tell you to do something or ask you to do something and they're not doing it themselves, how does that make the kid feel? Humans are the same. Adults are the same. If there's if there's an ask by elected officials and to please wear a mask when you're in public, and then the elected or appointed officials don't, people see that as hypocrisy, and they roll their eyes and they're like, well, they're asking me to wear a mask, but they're not wearing a mask, so there must be something they're not telling me. And it's so easy to demonstrate, it's so easy to do. I've got, most of the time, I have both a mask and I have a bandana. And when I'm going to be using a mask on and off, I use the bandana because I can move it up and down. So there's ways that you could do it to make it super convenient. But yeah, I think people expect to see leadership that models what the behavior that they're asking people for.
So there's a lot more than masks, obviously, to talk about during this pandemic, and as numbers continue to increase. I know there's a lot of negative things that are going around because it doesn't look good on the surface, but I'm curious if there's anything positive that you've noticed in the past like couple of weeks since things started to spike. If there's any like silver lining that we should be looking for.
So yeah, a couple things. Number one is that testing capacity has really increased in the last month, which is a good thing. You know, there's been controversy at these press briefings and, you know, with some statements made by folks in the executive branch that attribute the increase in cases solely to the increase in testing capacity. And that's not true. But what is true is that testing capacity has improved, and that's a good thing. I also heard some statements both this week and last week at the press conference suggesting that the health department recognizes that assisted living and skilled nursing facilities need to be a bigger priority because if you think about where the hospitalizations and deaths are coming from, it's from congregate settings with seniors in them, by and large. Yes, there are people in their 20s, 30s, and 40s in the hospital, but a lot of the new hospital admissions are from people in assisted living and skilled nursing, and most of the deaths are from especially skilled nursing. And so I have seen at least some discussion verbally that there's going to be an increased effort in assisted living and skilled nursing. They're still not disclosing the data, like the numbers of tests and the numbers of positives in those settings, which is disappointing. But at least I've heard, lip service at least, that there's going to be some more testing. Of course, there's a lot more that needs to be done in those settings, like some additional resources for infection control and a organized effort to do routine testing, especially with staff, because those facilities are basically locked down. Family members can't enter and visit, and so the virus gets in via staff. And so you need to have an organized effort to test staff. So that's another area that I think is that is encouraging. The other is that I'm hearing fewer and fewer grievances about the supply of personal protective equipment. So that seems to be improving, although not everywhere. There are, I know, many clinical settings where they're still having challenges getting PPE, but at least, in the acute care facilities, there appears to be a better supply of PPE these days.
So on the other side of things, what have you noticed that is the most troublesome to you, that looks very bleak at this point and you don't see maybe getting better, or it's going to take a while before things start to improve?
Yeah, so I'll start by just describing what the data looks like. And we see this dramatic increase in cases, part of which is attributable to increased testing, but much of it is attributable to more community spread. There's more inpatient hospitalizations. There's a diminishing capacity within the hospital system. We're still okay. I mean, if you get sick right now and you need an ICU bed, you'll be able to get one and you'll get good care. My concern is that on the track that we're on, we're approaching, I think all the models predict that we're on a track to where in early July, we won't have that extra capacity within the hospital system. And so you asked, where do I see as shortcomings? Primarily, my frustration is that there are some simple interventions that we could be using right now that could make a real difference that we're not using. And they're high return on investment, low cost items. And I'll just tick through them really quickly. Number one, a mandatory mask wearing requirement indoors and in public. Simple to implement, easy to do, high return on investment. Another is to have some compliance criteria for businesses as they open, and most of them are open now, but have a system by which there's some compliance. There's actually some monetary penalties or a complaint system or something so that customers can hold businesses accountable when they observe things that are unsafe. Right now, it's a purely voluntary system. Again, missed opportunity. A third thing, give cities back local control so that they can do some things within their communities as mitigation measures. I'll give you a couple examples of that. Number one is Santa Cruz County right now has tons of community spread. There are things that could be happening both at Santa Cruz County, within county government, some standards and criteria that they could put in place, and also the city of Nogales. But they're prohibited from doing those things because the governor's executive order won't let them do things on their own. Again, simple thing, has the possibility of having a big impact. Not going to get us to where there's no spread, but it can help slow the spread so that to minimize the chances that we exceed our hospital capacity. Another example is, pulling out all the stops to try to get the contact tracing up and running throughout the state. And what would have been a great thing is if the stay-at-home order was lifted, but it was contingent on counties getting enough contact tracing capacity before those communities would open. That was a great missed opportunity. And what could have happened was that the governor could have said on the executive order, look, as your county gets enough contact tracers, then the executive order in your county is lifted. That would have provided a huge incentive for boards of supervisors and county managers to put resources into their county health departments so that they can fund contact tracers, because businesses would be pushing the county supervisors to get that resource capacity in play. Missed opportunity. So that horse has left the barn, but we could still put some additional resources into contact tracing. And so to summarize, things like increasing the amount of local control that's possible, putting some compliance standards in place so that businesses have some stake as they open to comply with the CDC recommendations, a mask wearing requirement in public, better controls at assisted living and skilled nursing facilities, and finally increased contact tracing.
Last question for you. If you could grade the governor and state health director, Dr. Cara on how they've done so far, like positives and negatives, just of what you've seen. I mean, you know better than most of what decisions they have to make in the situation that they're in, being in that position yourself at one point. I'm curious how you would grade them. Doesn't necessarily mean like, oh, I give them a B or a C, but just
I'll do the grade. I'll give them the grade. But I'm going to give them a first semester and second semester grade.
Okay.
First semester is before May 2nd. I'd give them a B plus, maybe an A minus before May 2nd. Second semester starts May 3rd. I can't decide to give them a C minus or a D plus. And the reason I say that is because these are hard decisions. And so I'm not minimizing, the difficulty of making these decisions. These are hard things, very difficult decisions, but the second semester isn't over. Still, there's final exams coming up. And I would say, look, if you just look at the high return on investment, low cost items that can make a real difference and start implementing them now, we could bring that up to a B again.
Great. Thank you so much, Will. I appreciate you joining me today.
Okay. Take care.
You as well.